Hi, my name is Sarah, and the class that I'm going to be teaching today is intended for parents who are interested in helping control their child's asthma. Asthma is a lifelong chronic lung disease that makes it difficult for your child to breathe. Symptoms of asthma include wheezing, coughing, increased work of breathing, breathlessness, chest tightness, and pain. An asthma attack or a flare-up is the rapid onset or progression of the asthma symptoms. There are three main characteristics of an asthma flare-up. One, the inside lining of the airway swells, narrowing the space inside the airway, reducing the amount of air that can get through. Two, the muscles surrounding the airways become tight. This is known as bronchospasm. And three, more mucus is produced in the airways, which narrows them even further. Symptoms of flare-ups include wheezing when breathing in and out, increased coughing, chest tightness, feeling like you can't get enough air in and out of your lungs, behavior changes such as tiredness or irritability, not performing usual activities, and awaking more at night or earlier in the day. Triggers cause asthma flare-ups. One step in controlling your child's asthma is knowing what triggers a flare-up and avoiding those triggers. There are several different categories of triggers. One are allergens, which are substances that your child's immune system may be sensitive to. They're found indoors, outdoors, and can even be ingested. Indoor allergens are things like dust mites, which are insects that feed off of human skin, pet hair and dander, molds, and cockroaches or other pests that leave droppings or skin. To reduce exposure to indoor allergens, keep your home dry, well ventilated, and free from pests and other contaminants. There are also outdoor allergens such as pollen, mold, and mildew. To reduce your risk to outdoor allergens, stay inside during high pollen count days, keep your home and car windows closed, and use an allergen-grade filter in your furnace or central air conditioning system. Allergens that can be ingested are things like eggs, milk, soy, fish, corn, and peanuts. They're also found in foods and drinks processed with sulfites or that contain sulfites. These are things such as dried fruits, fruit juices, or shellfish. To reduce exposure to these products, it's important to read labels on all food products before giving them to your child. The air we breathe contains pollutants that can irritate your child's lungs, causing asthma symptoms. Common irritants include cigarette smoke, smoke from fires or campfires, smog, certain fragrances, aerosol sprays, and fumes from household products. Cigarette smoke is one of the worst airborne irritants. If you smoke, it's important to consider smoking cessation. Common environmental triggers include sudden blasts of cold air, heat, humidity, and very dry air. To reduce exposure to environmental triggers, have your child wear a scarf around their nose and mouth while going outdoors and have them breathe through their nose. Use central air conditioning and drink plenty of water. Stress or strong emotions can also trigger asthma symptoms. Certain infections, such as colds, flu, or sinus infections, can trigger an asthma flare-up. To reduce infections, establish a healthy diet, have your child exercise regularly, wash their hands, and get plenty of sleep. Have them get an annual flu shot, and sanitize things like doorknobs, faucet handles, and other shared surfaces regularly. If your child's exercise causes an asthma flare-up, have your doctor prescribe a quick relief medication to use before any strenuous activity. Medication is a key component to controlling asthma. There are 3 types of medications used to treat asthma: daily controllers, quick relief medications, and short burst medications. Daily controllers are used every day to prevent asthma flare-ups, regardless of your child's symptoms, even when your child is feeling well. If your child is feeling great, you may be tempted to stop giving the daily controller, but remember, they're probably feeling great because the daily controller is working to prevent the inflammation that you can't see. Quick relief medications are used as needed basis to relieve symptoms from asthma flare-up by relaxing the muscles around the breathing tubes. During a bad asthma flare-up, it may be necessary to use a quick relief medication several times a day. But if your child needs to use quick relief medications more than twice a week, their asthma is not well controlled, and it's important to notify their physician so that they can modify their treatment with controller medications. Albuterol is the most common quick relief medication. Short burst medications are steroids, liquids, or pills that are given by mouth in a burst, usually over 3 to 5 days. Use them early for a bad asthma flare-up to prevent your child from getting worse and having to go to the hospital. An asthma action plan is personalized for your child by their physician. It details when or how to use controllers, quick relief medications, or short burst medications. Controlling asthma is a continuous process that may be very overwhelming. Follow these basic steps to help make controlling your child's asthma easier. Watch for symptoms, avoid triggers, take medications as prescribed, and follow your child's asthma action plan. Remember that asthma cannot be cured, but it can be controlled. Thank you for taking the time to learn how to control your child's asthma.